And I just want to share this win that this patient had. So when she first came to me, she had long-standing knee pain. She was a healthcare worker, so she was on her feet all the time, running around the hospital, and needed to wear a knee brace pretty much 24/7, at least when she was working, to help her knee just feel a little bit more stable, comfortable, and less painful. So she went to her surgeon, or she went to an orthopedic doctor who had said, "Hey, things are okay, but realistically, I think your best option is a partial knee replacement." Hearing that was a little overwhelming, and so she thought, I don't know if this is the right time. She was, in her early 50s, which realistically you might need a revision at some point in your life after that. So she wanted to explore other options. She came to our practice, and on physical exam, realistically, most of the pain seemed to be coming from the medial side of the knee or the inside of the knee. On our ultrasound exam, we saw some sprain of that MCL. We also saw some kind of chronic degenerative tearing of the meniscus. And so, what we did for her procedure was we did a PRP, a really nice high dose of PRP, where she got about, I think it was about 12 to 15 billion platelets inside of the knee joint itself to help with the arthritis related pain. And then we did some injections into that MCL, so that ligament, to help that sprain heal a little bit. And then we injected around the meniscus where that tearing was. So the goal there is to basically put the PRP in that space where the meniscus can heal on the outside of the meniscus, help increase the amount of blood flow to the meniscus with that PRP, because PRP can help new blood vessels grow when there's areas of injury. And then we also treated the what's called the infrapatellar branch of the saphenous nerve. So that's a nerve that runs along the medial or inside aspect of the knee. And really, it was kind of a bystander for her, where the inflammation from the meniscus, the MCL, caused irritation of this nerve. And I believed that it was contributing to her knee pain. And so, with all of this, we did, the one PRP procedure, a nice high dose PRP, all ultrasound guided. So we specifically got it into the areas that we needed. She came back to me 3 months later, and she's 95% pain free. She's no longer wearing a knee brace. If she does, it's on very, very rare occasions. She's chasing her grandkids around the house, being able to go up and down stairs, which in the past was a big problem for her. And now she's able to do it again without a knee brace and with little to no pain.